Care teams in Cerner Millennium are a way of assigning and viewing the healthcare professionals responsible for a patient's care at any given time. They bring together roles, relationships, and responsibilities into one visible structure within the patient record. In this short training video, you will be shown how to assign a patient to a care team and how these patients can be managed by the receiving care team. Patients can be assigned to a care team using either the FirstNet or PowerChart applications. Within the patient's record, ensure the Manage MPage or the ED Clinical Information MPage has been selected. Here you will find the care team component. Any care teams already assigned will show here. In the top right of this section, you can assign a patient using the arrow and selecting Assign Clinical Staff Team. Use the arrows next to the relevant specialty and choose the required care team from the list. Now click the Assign button. This will now appear in the list. If this has been done by mistake and you wish to remove this, select the arrow next to the care team on the far right and click Remove. A care team list can be created using the doctor's work list, found in the grey Organizer toolbar, and the setup is very similar to your ward list. In the top left of this screen, you will see the Select List box. Ensure you have the Care Team tab selected, then click Manage Care Teams. Leave the Facility box unselected and, from the Treatment function, select the specialty required. Tick the box next to the relevant care team list, then click Save. Your list should now appear on screen. Before you can access the patient record, ensure you have established a relationship using the button in the top right. You can now access the record in the usual way by clicking on the patient's name. Patients can also be added to this list manually. This is done by selecting Add Patient in the top right. Search for the patient required and select the correct inpatient or ED encounter. Once you have finished with the patient, you can remove them by clicking the Select Rows icon in the top right. Choose which patient you wish to remove by clicking the tick box on the left of the patient's name. Now click Remove on the right-hand side. A key benefit of using a care team list is you can invite clinicians who may require access. This saves that clinician from having to create the list as just shown. To add a clinician, in the top right, select the page menu icon and choose Manage Care Team Staff Members. Select the specialty from the Treatment function and the care team from the team list. Now you can search for the clinician using the box below. Once selected, click Apply. This now gives that clinician access to the list. Another quick way to add a patient to a care team is via your ward list. But you must ensure you have the care team list already set up. From the ward list, click the Select Rows icon in the top right. Choose which patient is required by clicking the tick box next to the patient on the left. Now select the Add Patient box and choose the relevant care team from the list. If you then navigate back to the care team list, the patient should now appear. Thank you for watching this e-learning video. Further resources are available on eCoach, accessible via the FirstNet and PowerChart applications.